So I'm a nurse practitioner that's specially trained in critical care and trauma. So I've been doing that for almost 20 years and seeing how our healthcare system has been severely broken for a long time, especially when compared to other countries. Healthcare reform has been my major focus in my campaign. I've taken time to write out bills that are ready to go on day one when I get elected on how to start transferring us to a better healthcare system that's less expensive for the country, less expensive for the uh, um, average American. And these are things that can be done to give us better healthcare, cheaper healthcare, because the United States has one of the most expensive healthcare systems, but we offer some of the worst healthcare in the world. So when we compare ourselves to other first world countries like Canada, European Union, the UK, we are falling greatly behind. And some of the choices of the current administration has made that even harder for the American people, especially with the healthcare subsidies that have been done away with. That's significantly increased the price of healthcare, and the ripple effect of that has come into place is felt almost immediately. So the way my current job works as a nurse practitioner, I work in a hospital. I cover all the ICUs in that hospital. I stay there from 7 p.m. to 7 a.m. I do that for 7 days in a row, and then I'm off for 7 days in a row. I have a doctor that's there during the day, and I cover at night. And almost immediately, when funding was cut to Medicaid and Medicare, you started seeing rural hospitals in my region that could no longer pay for specialists like cardiologists, nephrologists, urologists. So either those rural hospitals were closed completely and you had hospital deserts where somebody has a heart attack and it's now an hour and a half ride for them to get somewhere to get some kind of emergent health care, all the way up to the point where that hospital's still there, but when they get there, there's no cardiologist available, so they have to be put on a helicopter and flown to me at a hospital that's in an urban area. So that is an extreme delay in care that is caused by these cuts, and hospitals just can't afford to pay to have a specialist on retainer. So they're sent to the urban hospitals outside the rural area. That's time delayed in care to that person, but it also overwhelms the urban hospital. So whenever I work in a hospital with 30 ICU beds. I cover all, actually, I'm sorry, 42 ICU beds that I cover all those ICUs at night. And you are constantly getting patients that are transferred from rural hospitals. Your hospital rapidly becomes at max capacity, and you have no place to put those patients. So then it becomes a transfer center's job to scramble to find a hospital that has an open ICU bed. I've had people flown in from Norman, Oklahoma,
Oh yeah.
because there was no ICU bed closer to them.
Wow.
So if you're talking someone having a massive stroke or a massive heart attack and time is of the essence to get them care, you've now messed around and got yourself outside the window of optimal treatment. So when they're making these cuts, this is the real world impact of it.
So working in ICU, like what is the one of the most common injuries that you come across?
So I originally started my career working in trauma. So I did that for the first 10 years of my career, and then moved to a hospital where I focus on critical care. But when I did work in trauma, it was victims of violent crimes, motor vehicle collisions, falls, domestic abuse, family violence, sexual assault, you name it, we saw it. So you see what happens when law enforcement isn't taking care of. And that is another big problem on my platform is when they've taken so much money away from local law enforcement and given it to organizations like the Department of Homeland Security, and then neglect what local law enforcement gets, then we're not able to take care of those trauma victims or prevent the trauma from even happening in the first place. For the last 7 years, I moved into critical care. So I haven't done trauma in about the last 7 or 8 years, but I predominantly do critical care. So you see people, I cover a medical ICU, a neurological ICU, and a cardiovascular ICU. And so, you see people with severe infections, you see people with strokes, you see people with heart attacks. So what I have seen a significant increase in the last couple of months is patients that are coming in their late 30s, early 40s that have had significant strokes. Um, and whenever I get, so usually the way the process works is I'm up in the ICU, the emergency room, doctor calls me down, says, hey, I've got a patient that needs to be admitted to the ICU. They're down here in such and such room in the emergency room. If you want to come see them, work them up, see what you can do for them. I go down, I see somebody that's 42 years old who's younger than I am, and he's had a massive stroke. You ask him, hey, what's your medical history? He tells me I've got high blood pressure. You ask him, what medication are you taking for that? Well, I haven't taken medication in 3 months. Why haven't you taken your medication in the last 3 months? Well, I can't afford it. So
Mhm.
the price of medication, which was simple preventative care, caused this person to have a massive stroke at the age of 40 that's now going to be a lifelong debility. So because we've moved so far away from what people can afford for preventative care, we have now caused detriment that's down the line. A simple doctor's appointment and reasonably priced medications could have saved that person from a lifetime of either physical therapy for years versus he can't move the whole left side of his body for the rest of his life. And that's someone 40 years old.
Mhm.
So you've got a good 20, 30 years ahead of you of your entire left side of your body being paralyzed. That's not okay. Whenever a prescription of blood pressure medication could have prevented that.